moving here, where you think, oh, I was a wonderful, successful nurse, and coming to Canada. And I give you an example, my first job. I tell this story all the time. I'm sure you've heard this before. I went to do home care nursing, and I got in the house, the door of the person I was supposed to help that morning get out of bed, and this person was already up on a wheelchair. And as I opened the door and the person saw me, said, "Leave, leave." I said, "No, I'm your nurse." He said, "No, go, you don't understand." I said, "No, I understand." "No, you don't speak English." I said, "Yes, I speak English." And he just came chasing me out on her wheelchair. I was crying. I ran. It was in a condominium. And I ran out to the commissioner at the front desk and said, "This is what happened to me. Please call my office." And the office called this lady, and she said, "I don't want her in my house. I don't want her in my..." So talking about racism, I know it firsthand. That was my first week at my work in Canada. And the next time I was sent to another person, at least this one said, "Give me the number to your office." And I'm standing there, and I gave her the number, and she called the office, said, "I don't want this person here." And the office said, "Why? Like, she's a very good nurse. You would have very good care from her if you allow her to work with you." So she reluctantly agreed for me to work with her. And after that, every time she asked, "Please, can you send Josephine to me?" We became best of friends. She even took me to her grandchild's graduation ceremony. I took her on her wheelchair to attend that event. And yeah, but I had to prove myself. So what is the point there? Proving oneself. We constantly have to prove. But why do we have to do that? To say, yes, you know, I'm a good nurse. Beyond this dark skin, there's a human being inside, but not just a human being. There's a great nurse, very knowledgeable, that will give you the care you need. But you have to prove that. And you know what? You have to prove it even to black people. I've had to work with black people even in, say, delivery room. I remember one time trying to start an intravenous infusion on a black family, and I step out to gather my material, and she asked the woman in labor asked the family member, "Do you think she's really a registered nurse?" They don't believe I'm a registered nurse because I'm black like them. So you come back, you make sure you perform your work well, for that is called internalized racism. And so you deal with those things. I grew up in Cross River State, where I was born. One of the things I remember, coming from a family without parents who are educated, I was excited to go and be part of what is being taught in school, and excited to come home and share with my mom and dad and tell them about what we're studying, whether it's just spelling my name, learning to spell my name. It was a thing of excitement. My primary school teacher, grade 1 teacher, was so excited to go and look for my parents, and came to my mom to tell my mom that this child is going to Makerere. And so when I look back, I thought, oh, Makerere, actually in Uganda, that used to be like the Harvard of Africa. And so my teacher was literally telling my mom, "This, your daughter is going to Harvard." And my mom was just excited to hear this. And I treasure how that teacher saw in me in primary school what I didn't see, and that has taken me along the way. So when people put me down, even here in the Canadian context, when you face racism, it's like, no, I know my teacher say I can do better than this. So it builds resilience, you know. And in fact, my Ph.D. thesis in Canada, I dedicated it to that primary school teacher from my village, who taught me that I could be anything I set my mind to be. I bring that up in terms of early beginnings, because just seeing a child that you don't even know who their parents are and believing in them and beginning to give me leadership role, that early confidence he gave me has taken me a long way through the journey of life. And so my high school education again was uneventful. Went to midwifery school in Obudu in Cross River State, and went to nursing school. I worked as a registered nurse and midwife before moving to Canada, where I began my university education. Studied at Dalhousie University for my undergraduate degree in nursing, and went on to do my master's degree. It was then my eyes opened to the needs of Black Canadians. While I was doing my research as a graduate student in nursing, I realized that every time I wanted to talk about Black Canadian health, there were no studies, there were no research. And so I would go to my mentor then, Dr. Barbara Keddy, a white professor, and said, there's nothing about Black Canadians. And she told me, you know what, you can be one of the solutions to these issues you talk about. Why don't you study some of this work? I would go to events in the community to learn more, and one time I went to this event where Black Nova Scotians were talking about their health needs not being met, and somebody said, all we're asking for is to have somebody who understands our need, someone who understands the way things are for us. And I went back and I said, I have to do something. I do understand those needs. I have those needs myself. And that was how I did my first study, looking at the childbirth experiences of Black Canadians, African Nova Scotian women. In that study, once I released the result, and I did it in a community-based project way. So we did community participatory project, and the women, I took them to the first conference or symposium where these findings were presented. The women acted a skit on stage just before I came on stage to speak about the study. And I had the media following me that week. I made front cover page on paper. It was like racism in healthcare, and I was terrified. I was invited to the radio station to talk about this study, and this was in Nova Scotia. I was encouraged, you need to let the minister know about this. So I wrote a letter to the Minister of Health to inform them about the study and the findings and the needs of the community. I followed up, and that became a lifelong journey. I had a relationship where we developed initiative. I was part of the transition team or task force that worked on Nova Scotia cultural competence guideline, the first province-wide guideline across a province in Canada. From that work, we've built on relationships and others, including the creation of the Health Association of African Canadians in Nova Scotia. I went on to do my Ph.D. focusing on that issue of diversity and equity in the Canadian healthcare system. It's interesting because for years, even when I published the book on anti-racist healthcare practice in 2009, at that time, one of the reviewers described it as the first of its kind in the Canadian literature. Because at that time, when you talk about racism in healthcare, nobody wants you to talk about that. I have people showing discomfort of me just talking about racism. There she goes again. So it's wonderful that today we can now talk about racism, and everyone has a shared and common language. Vision just continue, but is informed by my own experiences, and that is why I'm so passionate about it. Because when we're talking about the structural barriers that Black Canadians face, I'm one of those Black Canadians. My children are some of those Black Canadians that face this, and so I see it as a collective journey that includes creating a better world for our community, and working with people like yourself and many others to weave that fabric of a better community for ACB people and other communities that have been racialized. It's very deep, because when you think about the threats of racism, it runs deep beyond just what we see on the surface. Quite often we see the microaggressions, the everyday racism that you would face, those slights and infantilizing and scapegoating and other things you may find in places of work. But these are anchored by laws, right? At the system, at the institutional level. So we have those visible individual level microaggressions we see. Then we have this anchored in institutional policies and laws, those that invalidate racist experiences. So it's not only in institutions, one, say, healthcare facility, you find it in the whole healthcare system, in educational system, in criminal justice system, policing. These cut across each other to cause what we're describing today as intersectionalities. That's why we need intersectionality lens to address that complex web. I would say relatively we have more data, we have more ACB people leading projects and designing projects in ways that will work for the Black community. And again, I prefer using ACB because this is a more inclusive language. It includes A for Africans from the continent, B for the Black Canadians that have lived here for multiple generations in the Western world, and C for the Caribbeans, Black Caribbean people that again are people of African descent. So and we have diversity within this population. There's a number of initiatives that have targeted some Black community, including ACHO that had worked in this, but we also have more outspoken leaders talking about these issues, including the Black Manifesto that was presented at the CAR conference, the Canadian Association of HIV Researchers conference last year. Mentorship is a key part of the job I do. I have a cohort of mentees, people I mentor all across the country and even abroad. I have a mentoring group running even in Africa. As you know, I've had the opportunity to do the Carnegie Fellowship for African scholars in number of countries in the continent, mentoring people in Nigeria, South Africa. I've had the opportunity to work with people in Uganda and Kenya, in Jamaica, in Barbados. Again, sharing what I know, and that mutual exchange, it's an important part. But also part of how we do that is building the community capacity. And that leads me to talk about the organization we created here in Ottawa, the CADO organization, Canadians of African Descent Health Organization, CADO, which sounds like gift to our community, and that was the idea. As you can see in their logo, gift, the hands giving back to the community that has been a shoulder for many of us who've succeeded to stand on. And so this health organization that is dedicated to building the capacity of Black Canadians, but also advocating for the use of evidence to change policies and practices that affect the health of ACB people in Canada, is one platform that we use to mentor others. The organization has been instrumental in terms of helping even new immigrants as they get here and connect with the organization, to use that as a platform to leverage networks that CADO has to reach out, and some have gotten employment through that kind of leveraging. And through my work at CO-CREATH Lab at the University of Ottawa, we are training the peer equity navigators, the PANs, as people who will rewrite the story of health inequities in the ACB community. PANs are peers, and a peer model have been shown to work effectively in reaching out to peers. These are peers that are educated and go through 12 modules of training offered by the CO-CREATH Lab. Our model is very rich in terms of the analysis of racism and the pathways through which racism impacts on both our mental and physical health. So these people who are trained in critical racial literacy and critical health literacy, these are all components of the module. Then now we package information for them to disseminate in the community.